Well, my sweetheart put out an article that's been getting a lot of traction on LinkedIn and with a lot of HR departments. This article has been forwarded to I don't know how many people. I think we just had a gutful with Delta Dental being the butt heads of the dental insurance profession. Not all of them, just a handful of them, and it's going to be fun. Tracy's going to take it. We begin our podcast right there.
Welcome, all of you fantastic dental podcast listeners, to the My Practice, My Business Dental Podcast Show, where we help dentists profit and thrive with excerpts from the clinical business of dentistry training here at My Practice, My Business. We'll be addressing and answering questions with current trends dentists and their teams face each and every day in their pursuit of this wonderful career we call dentistry. And now the host of our show, the clinical director and president at My Practice, My Business, Dr. Rob Thorup.
It is not Dr. Rob Thorup. It is the wonderful MBA, much smarter than me business person, Tracy Thorup, the CEO of My Practice, My Business. She's going to take it from here. Take it away, sweetheart.
Oh, thank you. I feel very special being on the microphone, being able to talk the whole time. Wow.
Well, I might interject here and there.
Please do. This is great. Well, I have to start by saying that I was so frustrated because we're always talking about how the insurance companies are taking advantage, but I don't think our employer groups or our patients really are aware of what's happening. And so an article was due.
And the interesting thing is if it goes out to the employer groups, well, they're the ones that have been looking at this and they've been going, oh my gosh, maybe Delta Dental is not the company we want to go with. Maybe we should be looking at MetLife or Aetna or Blue Cross Blue Shield or somebody else. And your article, sweetheart, is just flat out bringing truth to people out there in the real world. And this is what the association should be doing. And this is what somebody needs to do. So take it away, hon.
Okay. So the name of the article is The Dark Truth About Delta Dental and Why Your Company Needs to Drop Them ASAP. Now, let me emphasize, your company does not mean your dental practice. We're addressing HR people in charge of companies, large companies, small companies, it doesn't matter. We need to make sure that they are aware of what's happening and how it's affecting their employees. So here we go. Before I start, let me be very clear with what I do and why it matters to you. So my husband and I work with dental insurance companies, insurance commissioners, state legislators, state dental associations, and representatives of American dental associations to ensure that both patients and their dental providers are protected against unfair and unethical practices by dental insurance companies. Very important to us. Why do we do this? Because there's no private entity in the U.S. that exists simply to protect the quality of dental care with both the dentists and the patients that they serve. There's a definite need, and we are here to fill it. My Practice, My Business has been around since 2006, and we intend to remain practice advocates for years to come. Recently, we were made aware that in addition to unethical changes Delta Dental has made in the past to positively affect their bottom line, Delta Dental of Washington has been notifying their participating dentists that they cannot offer and charge for enhanced technologies and techniques, better materials or medications to Delta Dental clients, despite the fact that these services are considered not covered by insurance. After further investigation over the last few months, I am sad to say that this looks to be correct. Oh boy. So first of all, it needs to be noted that when insurance companies negotiate fees with their participating dentists, the fees are based on the cheapest way to do the procedure. The contract states that reimbursement is made for the least expensive, professionally acceptable treatment. And I call it LEPAT. I don't really know if the acronym is spelled correctly, but I say LEPAT.
Yeah.
We understand that the insurance companies have shareholders to report to, and that definitely is a large factor in what's paid out in reimbursements to their dental providers. On top of very low reimbursement rates, there are additional tricks that Delta Dental is using to further pad their profit margins. The first thing is downcoding. Dentists are required to report services as they are performed, similar to how medical bills. By doing so, the dentist can remain transparent with what was done and why. For example, if a dentist does a 3-surface tooth colored filling, there's a specific code and an agreed upon fee between the Delta Dental and the provider for a baseline or cheap tooth colored filling that is charged out. However, Delta Dental is allowed to change the code to reimburse for an even cheaper silver or amalgam filling, even though it was never done. This affects your employees because they're under the impression that the service is covered at a certain percentage rate by Delta Dental. But we know that the difference between what they say they cover and what they actually cover is a lot less. This is easy to verify. Just call your Delta Dental representative if they have either an alternative benefit for services or if they downgrade services.
What's interesting is if we upcode, that's a felony. But downcoding, that's okay.
Oh, it's fine.
Why has dentistry allowed that to happen? That's $1 million question. Sorry. Okay, keep going.
Oh, yeah, absolutely. And why has nothing been done about that?
Yeah, I know. Well, we did here in Utah.
Oh, of course
with
we
our
did,
law, though.
'cause we're so
okay,
awesome.
keep going.
To continue on here, another point, bundling. Delta Dental will routinely identify a particular service or code that they feel that they're paying too often. We call it frequency. And then they'll make an internal decision to bundle that code into another service code in an attempt to pay less for the services actually performed. As a result of this, separate services that used to be considered covered by Delta Dental are suddenly combined as inclusive by Delta Dental. And when they bundle the services, they'll only pay for one of the 2 or more services. All Delta Dental has to do when they decide to bundle services is make a change to their provider handbook, which can be done as much as twice a year, with little to no notification to the provider or the patient. Interestingly, the American Dental Association states that bundling of distinct services by a dental insurance company is considered to be potentially fraudulent. In our opinion, there's nothing potential about it. It's fraud.
So true.
For example, clinical crown lengthening is a procedure that occasionally is needed to be done.
It's free.
Oh,
dentists are supposed to just do that for free.
Not at all. Yeah. But it's done when decay has gone into the bone, right below the gun line. Thankfully, it's not needed a majority of crown procedures, but it is supposed to be billed when it's needed to be done. It's a completely separate procedure. Delta Dental states that it covers this procedure. But if it's done on the same day as a crown, it's considered inclusive and not billable in the provider handbook, meaning that the additional charge for the additional service is required to be written off. The only way that you can get paid for it, according to Delta Dental, is if the dentist numbs the patient, does the crown lengthening, then has the patient return on another day for the crown procedure. Not only does that not make any sense from a patient care perspective, but when the patient wants to get numbed, worked on, and what patient really wants to be numbed and then worked on and then come back on another day to do the rest of the work?
But they love us. They love coming back to our office.
Right.
They want to see us every day. You know what's funny about that is if you think about the procedures that you're talking about, it's kind of like I do a procedure. There's a legitimate CDT code for it. Why am I not being paid for it? And the funny part of this is non-covered service laws throughout the United States help with this. But the most powerful laws here in Utah, the network leasing downcoding and bundling protections law, prevents them from telling us to write it off. And why hasn't the ADA been promoting that in every state? Sorry, on my bandwagon. Continue. I don't want to interrupt. Keep going.
This is where it gets frustrating because when the doctor insists on charging separately for the services performed as they have before, suddenly they're accused of unbundling by Delta Dental and they're threatened to be kicked out of network if they don't write off the additional services rendered. The dentist now has an ethical dilemma to make in the future. You either do the needed work, obviously, for free, losing your money, or not offer the service at all. Unfortunately, we see the latter too often. We've had multiple reports of patients not receiving buildups with crowns, or gingivectomies with crowns, or crown lengthening with crowns, pulp caps with fillings, ridge preservations with extractions.
Let's just yank out the tooth and have them bite on gauze because the insurance won't pay for it. And let's treat to the insurance limitations because that's the best thing to do.
And this list just goes on and on of services that are not being performed by the dentist because Delta Dental is refusing to pay and will not allow billing of those services, even though there is a substantial increase to the cost of the dentist or the provider to do that additional procedure. Forcing write-offs due to services not meeting requirements is also something that definitely needs to be addressed when it comes to employer groups. They need to understand this. When the dentist goes to school, they're trained to look for specific things that determine what services need to be done. And if certain services are needed, it's expected that the dentist documents the need for treatment for those services via x-rays, intraoral photos, chart notes, perio charting, or other methods. This is also not without oversight by many other entities, like the state's Department of Occupational and Professional Licensing. If a patient or an insurance company feels that there's overdiagnosis or anything similar like that is being done, then the state's Department of Licensing and Dental Board can be involved for discipline or license removal. However, Delta Dental is changing those standards of care by stating that if their lower, made-up standards are not met, then the procedure is not billable. Dentists who've been trained to do a service when particular oral conditions are met are now being told indirectly to wait until the condition worsens before they can get paid for those services. This is decreasing patient care, and it's setting the doctor up for potential malpractice lawsuits in the future. So an example would be periodontal disease. It's widely known in the dental industry that the insurance companies are requiring worsened conditions before they'll pay on treating the infection that causes periodontal disease.
Yeah, like we saw, instead of 4mm pockets, now some insurances are requiring 6mm pockets.
6mm pockets.
Yeah.
And if those requirements are not met, it's not billable to the patient. So now the doctor's, again, either doing it for free or risking malpractice by not doing that legitimate procedure to treat that infection.
And again, why is it important?
Because periodontal disease shortens lifespans. It's known to be fatal. It propagates a wide range of secondary medical conditions that could easily have been prevented with those higher standards of care. So now that
Good point.
Now that the previous and issues that are currently happening are being addressed, we are actually shocked at the most recent tactic by Delta Dental. Delta Dental of Washington, specifically Washington, is now telling dentists that they cannot offer and charge for enhanced technologies and techniques, better materials, and advanced medications, all of which carry an increased cost of goods and direct operating costs to the dentist.
Didn't Delta Dental of California recently and Delta Dental of Washington back in 2018, didn't they get sued by the ADA for trying to control the quality of care? And that, again, they're just back to their same old tactics. And the thing that we're finding interesting is they're just going after one or two dentists here and there, trying to make examples of them, versus the whole state of Washington. Dentists are upgrading and offering choice for certain procedures. And Delta Dental, they can't control the quality of care.
Absolutely
not. They're trying to, but where's their association in understanding the laws, which we talked about on a different podcast? Where's their association in understanding their state laws to protect their dentists? That's a major problem. But sorry, I interrupt.
No, I love that. And to go back to on the original statement, in the contract, it states that dentists are getting reimbursed for the least expensive way of doing a procedure. Isn't there a more expensive way to do things sometimes?
So are there better ways to do procedures? I mean, one with deductive logic and reasoning would think that maybe that's a possibility. But then you get these dentists, I have philosophies that I only do the best. And then when we ask them if they're doing the best, it's like, yeah, we're treating to insurance limitations, but I do the best. No, doc, you're not doing the best. If you're really doing the best, you'd be going to institutes of higher education and learning techniques and procedures. It's like, I don't place implants anymore. If I place an implant, would I be providing the best care for my patients? No. That's why God made oral surgeons and people who put them in all the time. I don't do that. So it's time to get off of our high horses and realize that maybe, just maybe, we might not be providing the best of care for our patients. And are we delivering on the very best that our training allows? And if we are doing that, are there better ways? Are there better implants, better composites, better crowns? I mean, the list goes on and on. Better bonding agents, are we buying those? Or are we racing to the bottom? Because according to the research we've done over and over again, the supply houses are saying, yeah, most dentists are buying the cheaper crap. So there it is. I mean, that's just fact, unemotional.
Per the American Dental Association, it is at the dentist's discretion how to satisfy the CDT code. If a dentist is only being reimbursed for the cheap or basic way of doing a procedure, including the baseline materials, then the dentist is allowed to perform the procedure in that manner, assuming that the dentist is doing everything clinically acceptable, of course. However, the ADA has also stated that a decision to bill for enhancements is a business decision that is not supported by the CDT code. Simply put, there is no CDT code for medication, better materials, or advanced technology or techniques. Because of this, if you were to offer the patient something besides the basic, which is what you're getting paid for, I would recommend creating an internal code in the office to represent those enhancements should he or she decide to offer them. It's similar to a dental office offering an electric toothbrush or whitening. They're not covered by insurance, and they stay between the doctor-patient relationship. And to clarify this point even more, by creating internal codes in the office, the dentist can also remain extremely transparent with these patients when discussing the treatment planning additional charges for these better services or products. In regards to non-covered services, like the ones mentioned above, Washington State actually has a non-covered law that states that insurance companies are not allowed to dictate the fee for non-covered services. As of the posting of this podcast that we're doing and the article that I posted a couple weeks back, 44 states have non-covered laws, with the American Dental Association actively pursuing the federal Docs Act, which actually will make non-covered services laws apply to federal dental plans, which currently don't have to listen to state laws. So I'm really excited for that. In addition to non-covered services laws, Washington State also has a stronger state law that prohibits dental insurance companies from interfering with a separate agreement for any service between the doctor-patient relationship.
That is one of the most powerful laws that we have seen in the U.S. And right there in Washington, right there, Washington State Dental Association, black and white, the stuff you're supposed to know about.
So
I'm not being facetious, am I?
No, not at all.
Just checking. Okay, carry on.
So 2 years ago, we reached out to Delta Dental of Washington, and we asked them specifically about enhancements. And guess what? They gave their blessing as long as two things were done. Number one, the patient had to be educated on those enhancements. 100% agree. You cannot just throw something at the patient without telling them about it and educating about what insurance is paying versus what their options are. The second thing, the patients had to sign informed consent, acknowledging and accepting the fee for non-covered services. The only exception really would be medication, because it's similar to fluoride. The patients really just say whether or not they want it verbally. And so we do treat it very similar to fluoride. Delta Dental of Washington also issued a statement back in 2013 indicating that technology, procedures, and materials that were considered investigational were by definition non-covered by the plan, and the patient would be responsible for them if they chose them. Delta's contract with dentists has two sections that also reinforces the patient's right to decide what goes in their mouth. The first one is discrimination. The dentist cannot discriminate against Delta Dental patients. In Article 1, Section 5, it says, neither member dentist nor Delta Dental of Washington will unfairly discriminate against any enrolled person in any manner. Any thoughts on that, Rob?
Well, I'm just sitting here thinking with what you just said. I'm look how many times they're trying to shut down these dentists from offering choice. And yet, if MetLife or Blue Cross Blue Shield patients that we have, so we have Delta Dental of Washington patients here, patients that are insured by Delta Dental of Washington. So if that's their stance, then I am absolutely discriminating when I'm offering choice to any other insured or non-insured patient. So it's like they're speaking out of both sides of their butt.
Well, and we're going to go a little further with that one.
Okay.
So the second thing in their actual contract, it states non-covered services. In Article 2, Section 11, it ultimately states that the patient is allowed to choose non-covered services. And if they choose those items, they must acknowledge and accept the additional fee in writing. So now we get to the fun part. Delta Dental of Washington is now telling participating dentists that the fee agreed upon for each code includes the better materials, all meds, and technology techniques, and dentists are not allowed to offer and charge for those additional services that go above and beyond the basic services rendered. Again, the contract states that reimbursement is for the least expensive professionally acceptable treatment. There's a little contradiction here.
Well, that's an oxymoron, because how are they stating that when they're saying, oh, it includes all the better materials, but we're reimbursing you for the least expensive way to do it. But yet it's including all the materials.
Well, and the bottom
what
line.
company can have it both ways?
One that wants to save face.
One that wants to make themselves look good.
They want to look good. And they've stated in writing, the contract between your office and Delta Dental of Washington clearly prohibits the practice of unbundling of services for treatments. It's the position that of Delta Dental of Washington that resin-based composites, ceramic, and supporting materials used to fabricate and provide direct restorations and crowns are included in the standard fee for completing the procedure and not eligible for an unbundling and upcharge. Well, let's be clear about this. When additional medications, better materials, or new technologies or techniques that have increased cost of goods and direct operating costs available, and they do not have a CDT code, they're considered a value-added service that goes above and beyond the basic way of doing a procedure, and they are considered by definition to be non-covered services. It is in no way unbundling, and anyone who accuses it of being unbundling is unfamiliar or simply uneducated and ignorant with that definition.
No, they're just flat out ignorant. They just are so controlling, and they will continue to be controlling until dentists and their associations grow some backbone and other body parts to actually stand up for what's right, legal, and truthful.
Again,
that's what we do.
Again, you cannot say in your contract that you're paying for the cheapest way to do the procedure and then suddenly state that the fee includes the best of the best. You just can't do it. So we've also done an independent survey of labs and dental supply companies in Washington state as well as throughout the nation. And we've confirmed that an overall majority of those providers that are in network with dental insurance companies are in fact ordering the cheapest materials and supplies available because they have low reimbursement rates. Is this really fair to patients, though?
No. Well, no.
I mean, if I were a patient, I'd want to at least know that I had options, right?
I mean, that's just like when I had hernia surgery. I stated to the surgeon, hey, look, I want the better mesh. And he said, I was just going to offer you a choice. There's a baseline mesh that's covered that one hospital buys that I have rights at. And if you want the better stuff, I'm going to have to take you up to a different hospital because that's the only hospital in the valley that actually purchases the better mesh. And not to be personal and break HIPAA rules of my personal medical conditions, but I'm just keeping it real with you people. There's differences in mesh. There's differences in implants. Why is Straumann the implant by which all implants are still judged by? Why is Filtech Supreme the composite by which all composites are judged by? Well, I don't know. You know, it's just, why do they have different price points?
Well, and it comes down to ethics, because here's the bottom line. It's unethical for any dentist to not offer choice when choice is available. The employees,
but they don't, Trace, because they They don't because they can't afford it.
Well, and they're told
can't
they
afford
can't charge for it.
and they
so
can't
why would they?
Yeah. I mean, it's like the dentists don't know what they don't know. I mean, you and I know contracts. We know what you can do. We teach and train on this to a level that is only taught in medical for dentists to actually be paid fairly for it and for the services that they do. But most dentists have no idea about this information. This is really keep going. This amazing article that you did. Yeah.
Well, and it's unethical for anybody to not have the options to choose what goes in their mouth. HR groups need to understand that their employees deserve to choose what medications are used, as well as enhanced materials and technologies and techniques that are used. And so when Delta Dental tries to tell the dentists that they cannot offer those choices and be paid fairly for them directly from the patient, they are now getting between the doctor-patient relationship, and they are dictating the quality of patient care, which breaks a majority of those state laws and their own contracts. One might actually think that they're practicing dentistry without a license, and it certainly is unethical.
So keep going. This is amazing.
If the dentist is prohibited from offering Delta Dental patients choice in their oral health care, yet all other dental insurance companies allow it, the dentist is blatantly discriminating against the Delta Dental patients, which is what you mentioned before.
Yeah, which violates the Delta Dental contract.
Mm-hmm, mm-hmm.
I mean, that's like Captain Obvious.
Yet Delta Dental's insisting on the discrimination, which forces the dentist to breach their own contract. Again, Article 1, Section 5. Neither member dentist nor Delta Dental of Washington will unfairly discriminate against any enrolled person in any manner. We're damned if we do.
And damned if we don't. And what's interesting is Delta Dental of Washington, they're the ones that we've seen that are doing this blatantly, but there's a couple other Delta Dentals throughout the United States that I'm thinking about that you and I have had to deal with.
And they've been great.
No, the majority are good.
Yeah.
It's just a handful like Delta Dental that controls Hawaii, Delta Dental of Oklahoma, Delta Dental of
Washington. And that's all I heard.
Pennsylvania is another.
Pennsylvania did some really funky stuff with their definition of covered services.
Yeah, they're like
that's going to be a whole other fun one to talk about.
Yeah.
So these HR company or these employer groups, what can their HR company really do?
But California, Utah, Georgia, they're all great.
Actually, California, Utah give their blessing in the handbook.
Right in the handbook.
For offering these services and the choices to patients. But again, you've got to do it the right way. And that's where I'm really happy with how we teach
Tracy, they're the contracts that every dentist reads and their office manager extraordinaires read.
Oh.
Don't you, office managers, whatever. That's why nobody knows about this stuff. This is why I love that we teach this so that offices can actually be profitable with PPO plans instead of listening to all the crap the associations state. Drop your plans, and lose your patients, and then you're not able to take care of some of those wonderful patients you've had and you've cared for years because they switched to another dentist who's taken the plan.
Mm-hmm.
And this is, such a misinformation coming right from our association. Sorry, keep going.
That's all right. Well, and here's the bottom line with this is Delta Dental is not ashamed of bullying and intimidating their in-network dentists. If a dentist resists these unethical changes, then they get removed from the provider network and they can potentially lose a lot of patients. However, Delta Dental is extremely receptive to employer groups, especially the
ones that we take care of.
Exactly.
Because that's where their premiums are coming from.
Mm-hmm.
That's the power that we have. We have the power to go to these companies. If an insurance company is misbehaving or trying not to follow state law, that's a power that dentists and their teams have to contact the HR departments. And how many of the HR directors are actually patients of ours?
And this is where it gets fun.
Okay.
Because if you can encourage your company, and I'm not talking about dentists now. These are employer groups. They need to call Delta Dental of Washington or any Delta Dental plan in the U.S. Really, it's imperative to ensure that Delta Dental redacts their statements on non-covered services and allows patients choice. They need to call and write Delta Dental's CEO, COOs. Let them know that if they do not allow your employees or their employees to choose those medications, enhanced materials, or technology and techniques available to them, then they will be taking their employees to an insurance company that will. And the majority, again, of all the other insurance companies do. In fact, we're currently unaware of any other dental insurance company that does not allow patient choice. And shouldn't it be the public's choice when it comes to their oral health care instead of the dictates of dental insurance companies?
You'd think.
When these companies talk to the CEO, COO, make sure that they ask for response in writing, that their participating dentists are allowed to offer and charge for medications, better materials, and technologies to their employees. And they will not get between the doctor-patient relationship. Be firm with this request because it's easy for them to say one thing and then dictate another. In addition, have them state in writing that any dentist that offers enhanced materials, non-covered technologies, or techniques and medications to their clients is not at risk of being removed from the network, as long as the patient's aware that those services are not Delta Dental's responsibility and will be the patient's responsibility should the patient choose them. If Delta Dental cannot put this promise in writing, then you definitely need to take the employees. So I'm talking about these companies. They've got to take these employees to another dental insurance company that will.
So, you know what's interesting about this, Trace, is I remember when the ADA came out with, there's a term for it, and it slips my mind right now, but it was literally promoting in-house plans.
Mm-hmm.
And so what you're stating here is the dentist can actually have this kind of conversation with HR departments and literally state whether an insurance company is allowing choice or not, trying to control the quality of care. And how would you like to be like, I don't know, how would you like to be Boeing, Nike, Kennecott? I mean, any large group, that has an insurance company, and the dentist is, and I, the dentist, go to you, patient, and I say, just so you're aware, your insurance company tries to control the quality of care that we're able to deliver to you. It's no different than United Healthcare putting all of us, signing us up without our permission under Medicaid, and then finding out that we have to write off all kinds of crap, or Medicare. You don't have to whisper it. Medicare. It's okay. I made them, Medicaid, Medicare, it's all, seems like all the crap. Yeah. It's like, I got the expert sitting next to me, guys. I'm going to get corrected. And I'm grateful. I'm grateful that my wife knows this stuff inside out. But the power play is, it was called direct reimbursement. The ADA's whole program on direct reimbursement. What if instead it's like direct truth? Why doesn't the ADA put out something like that? State associations put out this kind of information that insurance companies are doing, that if we have somebody from the HR department as a patient, we can inform them on which third-party payers trying to control the quality of care and which ones don't, and that their employees should be signed up for those insurance companies that don't try to dictate socialized dentistry.
Well, Washington State actually has a law that states that the dentist is allowed to speak to patients about treatment rendered, and also they are, per the Delta Dental contract, the dentist can actually speak about Delta Dental even if it's disparagingly. So, if you're in a situation where the patient walks in and you're saying, hey, listen, I just want to let you know, I'm getting paid for the least expensive way of doing this procedure. All of the other patients in here that do not have Delta Dental are allowed to have better choices, but unfortunately you can't. That's going to be interesting. So
reminds me when I was in dental school and there was a OB guy out in the San Francisco area, and his better insured and fee-for-service patients went down the left side of the hall. It was carpeted, plush, beautiful. And then the HMO patients went to the right, where it was just like cold brick wall. This guy did this.
Yeah.
And
that's a good point.
Yeah. It was like, yeah, this is how these patients get taken care of, and this is how you get taken care of. Yeah. Anyway, sorry.
Well, I finished the article by urging employer groups to reach out to us. If you have any questions on the unethical practices of Delta Dental of Washington or Delta Dental in other states, dental state laws, dental insurance contractual agreements, or anything pertaining to the subject matter, reach out to me. And in fact, reach out to us. We beg you to, because this is the only way that we can increase the quality of patient care for the employees in those companies. In addition, we have audio recordings, written documentation, and more available to these HR departments of these companies if they want to hear the truth for themselves.
What a powerful way to tackle the problem. And here again, docs, team members, we have laws in our states that protect us from the unscrupulous dictates of insurance companies. You just need to know how to apply them. And you need to know how to push back. That's what our training does, which all of you who have been through our training that are listening, just a gentle reminder again, don't ever cave to their dictates because the laws do protect you on being able to provide the highest quality of dentistry that your training can allow. You don't have to write it off. You don't have to race to the bottom buying the cheapest stuff.
Other than that, we are always going to be here for you. Hopefully, we can educate the public on what's going on with Delta Dental of Washington. Big things happening in the future. But again, hopefully under pressure from the public, Delta will change course and fall back in line with all of the other insurance companies that allow patient choice as they should. The more educated we can be on what's being done, the more we can take a stand and help dentists in Washington state, as well as dentists in other states and the patients that they serve.
Tracy, sweetheart, thanks for bringing attention to this article that you wrote to the HR departments in multiple states, and it's going to be fun just to see how many more people contact you and ask you, like, and these are people outside of dentistry, my friends. These are corporations that are contacting her and going, "Oh my gosh, we've seen this. You put it in words that we can't explain. What insurance companies do you recommend?" It's like, if they're small companies, it's like, just go do an in-house plan, but we can't call it an in-house plan. It has to be called a membership club or something in some
there's
states.
Specific verbiage that you've got to make sure you fall in line with.
Or there's other insurance companies that again, dental insurance isn't true insurance. It's a dental benefit plan that contributes funds to patients in need of dental care. And the more we educate our patients that it's just a contribution and not a true insurance, the more powerful it becomes.
It really does. And going back on your point, Rob, is we need to start looking at this from a different perspective. Instead of running to the fence and saying drop insurance and holding picket signs and yelling, we need to realize we need to take a different approach, which is educate your patients. Talk to them about what what their dental benefit plan really pays for, and explain to them why it's not a benefit for them anymore. It's worth looking at other avenues.
Yeah, especially the Karens and Kens that come into your office, front office team members, and tell you how to do your job. Make sure you stand up for yourselves. And docs, make sure you stick up for your team members when they're confronted with those types of individuals. And don't be afraid to dismiss those patients from your practice if they're too big of a pain in your butt. But thanks, sweetheart. That was fun. I hope all of you have a wonderful day, and till you hear from us again.
Thank you for being with us today. Since 2006, My Practice, My Business has been teaching dentists and their teams business skills, dental insurance contractual protocols, and state laws governing how to profitably bill patients fairly for the need-based services they provide. What's more, we guarantee our training, unlike other dental consulting companies in the industry. Simply stated, if you don't increase your net revenue, we don't get paid. We call it dental consulting the way it should be. We believe there has never been a more important time than now for dentists to experience and implement our key methods, knowledge, and business training within their dental practices. To learn more about our guaranteed, no-risk clinical business of dentistry training that is changing dental practices for the better, just go to our website, mypracticemybusiness.com, and surf our pages for additional information about our company and the services we provide. When you're ready, give us a call and get scheduled for the most profitable dental business training that you will ever experience. If you enjoyed our podcast, please leave us a 5-star review. If you have any questions, please don't hesitate to call us. Thank you again and have a fantastic day.